This is the SoCal Update. I'm Leo Duran. Today, thousands of childcare providers have shut down for good during the pandemic. We'll talk about the impact on families, kids, and these business owners. It's Thursday, February 18th. Unlike schools, childcare providers were never forced to close during the pandemic, but many families ended up keeping their kids at home anyways. That meant declining enrollment and the challenges of operating a facility during a public health crisis. Mariana Dale is here with us now, and you had been talking with providers for months. Where has this left them?
Well, since the start of the pandemic, 3,122 childcare providers in the state have reported permanent shutdowns. A third of those closures are right here in our neighborhood. So that's LA, Orange, San Bernardino, Riverside, and Ventura counties. And I think it's really important to note that the state had already been losing childcare slots for years. Part of it's economic. Childcare workers in LA County, who are largely women of color, make on average less than 15 bucks an hour. Public funding doesn't support the true cost of quality childcare, and parents often can't afford to pay more than they're already paying.
All right, then, Mariana, what about those providers who remain open or were somehow able to reopen?
Well, there's about 34,000 of them throughout the state right now, and they're having a tough time too. In one survey from UC Berkeley, 77% of open childcares reported that they were still losing money. The cost to operate is up with the need for cleaning supplies and PPE. Centers are installing new plexiglass barriers between each kid's desk, for example, and at the same time, their revenue is down. Larger centers, especially, have had to cut their enrollment to comply with public health guidelines. Childcare advocates say without financial relief soon, we may see many more closures before the pandemic ends.